It almost sounds too good to be true. Healthcare without the nightmare that can be health insurance these days.
Tonight, KCTV5 is investigating your fight for healthcare. Investigative reporter Emily Sinovic introduces us to a group of doctors trying something called direct primary care.
No co-payments, deductibles, premiums, or out-of-pocket maximums. Nope, nada. Just a flat fee every month. It kind of sounds like a crazy idea, but a couple of Kansas City doctors decided dropping insurance altogether was the only way to do what they signed up for in the first place, actually improve patients' health.
Hey, Rob.
Hey, what's up? That's about the speed here.
Emily, usually our appointments are 30 to 60 minutes. You might be here for a while.
That's Dr. Hasid Ahmed giving me the heads up. Things work a little different here.
And let me know through email or something like, hey, these are the numbers I'm getting.
We stopped by to see how this whole direct primary care thing works. That's Rob, one of Dr. Ahmed's first patients 3 years ago.
Change is hard, but once you make it, you'll realize you should have did it a long time ago.
That's exactly what Dr. Ahmed hopes more and more people like Rob see. Change can be good.
The way we have the system created, and it's just spiraling out of control where we're just reacting with more regulations.
After years of working in a hospital battling insurance companies.
Have you ever been in a shouting match on the phone with an insurance company?
I have, yes.
He felt like doctors and patients were losing their voice in the fight for insurance coverage.
My wife will tell you, she just said, you know, every year that you're working, you're just getting mad and you're frustrated and I'd get quiet and because you start to reflect, you're like, what's my purpose?
He turned his frustration into his mission. 3 years ago, co-founding Health Suite 110, a direct primary care clinic without the health insurance. A leap of faith for a doctor to take on the new title of business owner with no guarantee patients would buy in. But he had a feeling if he built it, they would come. Patients, that is. Now about 800 total at Health Suite 110. Patients like Rob who like the less formal, straightforward way he can interact with his doctor.
I'll call him or text him. I don't even come in a lot of times, and I'll just tell him this is what's going on.
It frees us up, and we can actually take care of the patient.
Here's how it works. Patients like Rob pay a flat monthly fee based on age. Rob pays $75 per month. The younger you are, the less expensive. Unless you're 100 years old plus, you get care for $1 every month, $1. That monthly fee covers unlimited access to physicians around the clock. Email, FaceTime, text communication with your doctor, and it goes beyond just basic care, i.e. things like EKGs, breathing treatments, joint injections. And there are discounts for imaging, labs, and medication. Take CT scans, for example. Here's one bill we recently saw from a patient at St. Luke's ER, where a CT scan was more than $3,700. Dr. Ahmed says thanks to the partnerships they have with other medical providers in the community, patients could pay a fraction of that price, $200, maybe $400 cash, taking away decision-making from insurance companies, giving it back to patients.
The word liberating comes to mind, or just freedom. I mean, just from a patient standpoint, from a physician standpoint, it just liberates you.
There's a lot more to talk about when it comes to direct primary care. It's a lot more complicated than we can describe in just a few minutes on TV. But we've got all of that information on our website at kctv5.com. And we are continuing to investigate your fight for health care, and we want to hear from you. Contact us at investigate@kctv5.com. I'm Emily Sinovic, KCTV5 News.